Hi, Dr. Bo here. In today's video, we're going to be talking about the newest lens on the market, which is the PanOptix Pro made by Alcon. This lens came out in May of 2025, so it's only been out on the market for about 2.5 months or so. And so there's been a lot of hype and excitement around this lens, both from surgeons and patients. And so in today's video, I'm going to be taking a kind of first look at the lens and giving you my thoughts and impressions about it. Here I have the Alcon website pulled up, and this is kind of the landing page for the Clareon PanOptix Pro by Alcon. If you're not familiar with the multifocal lenses made by Alcon, the predecessor to this lens is the original PanOptix. It's a multifocal lens, meaning that the goal of this lens for at least when using cataract surgery, is to give you that full range of vision and not having to need to wear reading glasses after. So you'll be able to see at distance, at the intermediate range, and of course all the way up close. And there are a lot of lenses now that are marketed as multifocal lenses along with the PanOptix. You have the Bausch & Lomb NV. You have the J&J has their Odyssey, and so there's kind of a lot of competition going on. And so it's always exciting to see these new lenses that come out and see how they perform for patients. This is the Clareon PanOptix Pro, and their website's really quite nice. It has this nice blue aesthetic, and it says light, and I think that's kind of the selling point for the lens, at least the way that they're marketing it. It says to discover more light utilization with less light scatter. When we scroll down here, you can see it says everything you love about the Clareon PanOptix, now with less light scatter. Unprecedented 94% light utilization. And so this has been a selling point for this lens, at least when I've talked to some of the reps. You can see here in the fine print, the original PanOptix had a 88% light utilization. And so we think about it, if the perfect multifocal lens would use all 100% of the light. And so the PanOptix was only able to use about 88%, sorry, meaning that 12% of the light entering the lens was basically lost to scatter. Now with the PanOptix Pro, they're saying that this lens will use 94% of the light. And so that is about 6% of the light still being lost to scatter. And that's why they're marking here. Here you can see it says 50% less light scatter by harnessing 94% of the total light energy. So it seems like it's a definitely a significant improvement, but I have some reservations about that statement because 6% improvement in light scatter, how much would a patient actually be able to appreciate that, right? It's one thing to say, yes, it's a 50% less light scatter, but is it clinically significant? I mean, can you, as a patient who gets this lens, actually notice any sort of difference in brightness? And we'll have to kind of wait and see as more patients get this lens, whether it's an appreciable difference in brightness when compared to the original PanOptix. It has the lowest light scatter of any trifocal, and it seems like here they were comparing it against other lenses like the NV, AT Alina, Rayner, Geometric, so a couple lenses there. Uninterrupted light distribution across the full visual range. And they have a little nice graph here just kind of showing that really getting a nice distribution of light between all the different focal distances. When we scroll down here, this table says designed for better image contrast. So this table is really to compare the contrast between the original Clareon PanOptix to the new Clareon PanOptix Pro. And on the far left side of the screen, this is for far distance, and then we're looking at far intermediate, and then at near. So I'll kind of walk you through this, but for the far, we have these two, the light purple, which is the Clareon PanOptix, and then the purple, which is in the Clareon PanOptix Pro. Pretty equal at far. If we look at intermediate, also really quite equal. And then here at near, you're seeing a slight difference between the two. The Clareon PanOptix scored 27, Clareon PanOptix Pro scored 28, which is about a 4% difference. Here at the far intermediate range seems to be where the biggest difference is between the two lenses. The original PanOptix scoring 18 and the Pro scoring 20, which they quoted at 16% difference. And this is the part that confused me a little bit. I actually ran the numbers myself. At least comparing this score of 18 to 20, it's actually only about a 11% difference between the two. So I'm not really quite sure how the calculations are done to give a score of 16%, but I'll have to ask the Alcon reps the next time I see them. Here, they're marking this as the Enlighten NXT Energy Bridge, and so that's the technology that they're using to really improve the light scattering. I do like this figure here down at the bottom. This is just to show us how the light is distributed across the different focal points. Again, here at the 0.5 or 0.0 diopters, this is your far vision. And then on the way right at minus 2.5 diopters is where your near vision is. The original PanOptix is on the bottom. You can see here at the far range, really nice distribution of light. And then also, of course, at the near range, you get a nice distribution. But here, between minus 0.5 diopters to minus 1 diopter, you're getting a lot of the light loss. And this is, I guess, probably due to the scattering. And if we look at the Pro, we're getting a lot more light here in this range. Now we scroll down further. This is talking about, minimizing visual disturbances. And so the main complaint with using the PanOptix or any sort of multifocal is some of these visual disturbances, which is, starburst, you can get haloing, you can see glare. And so if these are a concern for you, really the PanOptix Pro maybe is a little bit better, but you're still going to see these side effects. And so if it's a concern for you, or if you drive a lot at night, then I probably would strongly consider going with a different type of lens, either a monofocal lens or extended depth focus lens. You still might get some of it, but probably to a less extent than the multifocal. But if it's a big concern for you, a monofocal lens would still be the best choice there. Now, you do have to kind of carefully interpret how they're making these statements. Here for starburst, only 2.6% of patients were bothered very much by starburst. And so, again, the key point being is that only 2.6% were bothered very much by starburst. And so this is obviously a very different statement than saying only 2.6% of patients had starburst. Same thing if you look at halo, only 1.4% were bothered very much by the halos. Obviously the number of patients having halos will be significantly higher than that. And only 0.8% of patients were bothered very much by the glare. And if we scroll down further, outstanding spectacle independence, true comfort at intermediate distance, high quality near vision up to the very close distance of 33 centimeters, freedom from glasses even in low light. Again, this is really kind of the selling point for any sort of multifocal lens, is that you don't need to wear reading glasses after surgery. But keep in mind that these lenses aren't perfect, and so there's always going to be some sort of trade-off. If you're getting more range in the vision, then for these multifocals at least, you're probably going to lose a little bit in terms of the visual clarity. You're losing a little bit in terms of the contrast sensitivity. And so those are things that are definitely important to consider when deciding if you actually want a multifocal lens. If you're okay wearing reading glasses and really don't need to be spectacle free, then I would say it might be better to think about getting a extended depth of focus lens or a monofocal lens instead. And that's pretty much it here. Are you ready to level up to the Power Pro? Okay, cool. So, overall, I think this lens sounds very promising. I'm still in the process of, just now starting to implant this lens myself, and I think many other surgeons are kind of in a similar position. So we'll see in the coming, hopefully months, as more surgeons and patients are utilizing this lens, what the general consensus is about whether the PanOptix Pro is really able to deliver on what it's marketing, or whether it's just marketing hype and really is more or less the same as the original PanOptix. We'll be able to get a better idea hopefully soon. If you have any questions, please do drop them down in the comments. And if you've already received the PanOptix Pro, I would love to hear about your experience with the lens and how your vision's been, and your overall thoughts on the lens. And then, of course, as always, if you enjoyed this video or found it helpful, please make sure to like and subscribe, and I'll just see you in the next video then, okay? Take care. Bye.